Welcome to the Vortex.
Usually it's like darts, like I was saying. You get the bullseye, you see lots of shifting, lots of changing. But if not, you get something close, this gets better. Then another remedy, this goes away. Another remedy, this goes away. So usually it's kind of constant progress. And slowly, I think it's hard for all of us to see that we're better emotionally because we live in our own body, in our own world every day. Often it's after a year.
Changes we don't recognize.
We don't. Yeah. I know when I did my first homeopathy, I would say to my homeopath, well, I haven't gotten a sinus infection. That's amazing. That's great. It's been 2 months. That's fantastic. But now I'll really believe it. If I can go 4 months, then I'll really believe it. Then I'd go 4 months, and then I'd say, but if I could go 6 months, and then I go 6 months, and
this is typical human life.
It is, but see, this is how it is because I wasn't able to see how other changes were happening. I mean, I changed my place I live,
and it's hard to release also.
You
had it, you used to it. So
yeah, well, for some people they can't release it. I think they're too stuck to having their disease. But I think really it's like looking back after a year and then go, wow. My life's different. And one of the things I do now in my practice is I type my cases. So when the patient's talking, I'm trying to look at them and then I'm typing. And then after some time where I think they're much better, but maybe they don't recognize that emotionally they're that much better. Maybe their symptoms are gone and they're happy. But I read it to them and they go, oh, I really said that? You're kidding. Wow, that was wow. So it's really good to do that because they know maybe their physical symptoms are better. But when you do that, then they start seeing. So I think you just work on the level as it comes up. And if someone's really closed and they can't open up and talk to their homeopath, it's a difficult case because we need to know who they are.
They are not ready for really healing yet. I mean, just superficially, that's what you
have to open and you have to trust and you have to establish, like you were saying, Mattie, a long-term relationship with any alternative health. It's a longer journey than it is to do a pill, a medicine. Of course, but the reward at the end is happiness and health. Exactly. And it's
fulfilled life.
It is, and it's a journey, and you learn a lot through your healing. And I try to tell people that don't waste your money and come if you're going to come and feel like, oh well, it's 2 months and I'm
cannot
better.
Commit.
You have to commit, and it's not like they have to come every week. Usually what a homeopath does is you see them, then I tell them, okay, take your remedy and I'll see you back in 2 months. So 2 months. Then they come back in 2 months. If they're making some changes and they're good, then I'll say, okay, come back maybe one more time in 2 months. If they haven't done very good and we change the remedy, then I definitely want to see them again in 2 months.
Depends on
the next time. If they're doing better, I'm saying, okay, you're good. Why don't you just check in with me in 6 months? If you need something. But sometimes I only see a patient 2-3 times. It depends how sick they are and what their pathology is. If someone has really anxiety, like panic attacks, they're going to need more kind of you holding their hand, and they're going to need you there a little bit more
often to see you.
Because they have a really serious pathology. Or if they have a really bad case of MS or something like this, they need. But still, I wouldn't see them more than once a month, and usually after 5 or 6 times like this, then they start spreading out. It's more often I see patients every 6 to 8 weeks for 2-3 times, and then it's further apart. And then I'm lucky if I see them once a year because they usually either stay healthy and just come when they need me.
Very nice. That sounds good. So it comes to my mind actually, more ready am I for healing and changes, and more committed I am to it, less practical. It's easier it goes, and less help I need on the way along. Easier to maintain. So that's one very important question. It's important for me. What would be the biggest success of healing help? What you had in your years of experience? It's a hard question, I am sure, but what you say that was the biggest that you ever seen, and you might still have look at it today, so still connect, and that went excellent.
So you mean like in a particular
case, a very
case?
particular patient?
Well, one of my longest cases is of a patient who had a really bad cough. I mean, so bad. It was a child. He was like 5. And so bad, he had to go to the hospital and they would have to put adrenaline in him. So almost to the point where he'd have like a heart attack, like vomiting. And he would have this every 3 weeks. So it was really serious. And his mom brought him to me, and she was doing a lot of homeopathy herself, trying all different kinds of cough remedies with not much success. So he had taken lots of remedies. So when she brought him to me, I prescribed a remedy, and I gave it in a dose that was a little bit higher than maybe I usually would, but because she had told me, oh, he's taken so many remedies, he's never had an aggravation. So I wasn't worried about him getting worse in any way, because he'd had literally 100 remedies.
Tried a lot of stuff.
So I gave no, but she lived in a country that understood homeopathy.
I see.
So then I gave him a remedy, and he aggravated, and he not only coughed, but he became very anxious, which was part of his state already. But after this aggravation, which lasted maybe 3-4 days, he was better. And for 2 years, he never had one bout of cough for 2 years.
So you hit the bullseye.
That was pretty much a bullseye. Since that time, he's still my patient, and as you said, because the world is a stressful place and we live, and kids have peer pressures and school pressures and parental pressures, and so he now has occasional bouts that we have with his remedy, takes care of it quite well. But like I said, it's part of his chronic state, so now he takes his remedy, and hopefully in time that will be less and less, and it is very infrequently now he would get a cough, and it's never like it was before, never with this intensity, never needing to be alarmed like that.
I pick up something on that child. You know me.
Yeah.
So my question is, did you find out something? We don't know the child, we don't know the name, so it's okay to share. Did you pick up something deep that caused it? I mean, that's what I'm really interested in.
Yes, because what we call etiology in medicine is what did this come from? What was the cause of it? So in this case, he, as a very newborn, for some reason, something happened. He was put into the hospital, back into the hospital. He got sick, and they put him in the hospital. They took him away from the mother, and he was a very small infant. And they locked the mother out of the room, and they were trying to put an IV into his arm, and the baby was screaming. They couldn't get it in, and they had to actually move him to another hospital, and they wouldn't let the mother be with him. So my feeling was that he had been pulled away from his mother, and he was in complete terror. I mean, you can imagine. So I think the fear was almost as if it was a shock, because it was so fast. They ripped him away from his mom, and he couldn't be in the same room with her, and she was nursing and couldn't feed him, so he was starving, and it was just this trauma of them trying to do something to him, and he is too young to know the difference, but his reaction, it was screaming, and you could tell by his reaction that it was a kind of terror.
That's his cell memory. So today you could say he needs the cough to get the mother always close.
Right.
Don't leave me alone, almost.
Yeah, and his cough can be very emotionally based, as a lot of our ailments can. But in that case,
sick, stay with me.
So in that case, we have we say a rubric, but a symptom in homeopathy that's called ailments from. So in this case, it would be ailments from terror, ailments from fright, right? So he had some horrible terror, and ever since that moment, his body went into a state that he became sick. So the remedy that I gave him actually was not that well known to be a cough remedy. It was very well known to be more a terror remedy.
Exactly.
Because you treat the, if you treat the cause often, like I always find it really interesting when I get a child whose mom, I have to ask the mother a lot about the pregnancy, right? So the mom will say, oh, I was so anxious I was nervous, I was anxious, I was stressed at work, and I always was, and then whatever remedy the mom needed in that pregnancy, I usually give it to the child, and better.
Great.
It's amazing.
This was